Hello everyone, welcome back to another recall session. So today we're going to discuss with you about the recall questions of Physiology INI-CET 2021. So let us start discussing the questions. The first question is, which of the following is not involved in renal autoregulation? So let us look at the options. Tubuloglomerular feedback. Yes, it is involved in renal autoregulation. Myogenic reflex. Yes, it is involved. Renin-angiotensin system, yes, it is involved. Renal sympathetic fibers, it is not involved because if renal sympathetic fibers are absent, then denervated kidney is also able to maintain blood flow like normal kidney. Okay, so renal sympathetic fibers is the answer. It is not involved in the renal autoregulation. The formula for urea clearance is U into V upon P, where U is actually urine concentration of urea in milligram per 100 milliliter. V is actually the volume of urine and P is actually plasma concentration of urea in milligram per 100 milliliter. So the answer is urine urea in milligram per 100 milliliter D. The next question is the relaxation of the intestinal segment distal to the segment with the bolus of food during peristalsis is because of. So they are asking this one is bolus of food. They are asking the relaxation of distal intestinal segment. So there is actually two types of chemicals are involved in front of the bolus and behind the bolus. So in front of the bolus, the chemicals involved are vasoactive intestinal peptides and nitric oxide. And behind the bolus, the chemical involves are substance P, neuropeptide Y, and acetylcholine. Okay. So let us look at the options. They are asking actually the intestinal segment distal to the segment of the bolus. So in front of the bolus or distal to the segment of bolus, the chemicals actually involved are vasoactive intestinal peptide and nitric oxide. So first option is vasoactive intestinal peptide. This one is true. Substance P, no, it is actually involved in behind the bolus. Dopamine from adrenergic fibers, this molecule is actually not involved in any kind of intestinal peristalsis. And acetylcholine from myontric fibers, this is also actually not involved. So the answer here is A, vasoactive intestinal peptides. So this is actually involved and it is involved in the front of the bolus. The next question is, a patient presented with severe watery diarrhea resembling that of rice gruel stool. Damage of which structure is likely to have resulted in this diarrhea? Rice gruel stool is actually suggestive of cholera, and cholera is mediated by cholera toxin. And cholera toxin actually acts on intestinal tight junction made up of zona occludens. Okay, so the answer here is A. Zona occludens. Gap junction, adherent junction, and hemidesmosomes are actually not involved because these are not the example of tight junction which are affected in the cholera toxin in cholera. Okay, so the answer here is zona occludens. The next question is beta HCG is structurally similar to which biochemical moiety? They are actually asking about beta HCG. Structurally similar moiety they are asking. This one is simple and straightforward question. Answer is luteinizing hormone. Okay. So beta HCG is structurally similar to A. Luteinizing hormone. The next question is what is the duration of short-term memory? So this is also a very factual question. So short-term memory duration is actually seconds to minutes. So among all, 30 to 300 second is actually suggestive of seconds to minutes. So the answer here is C, 30 to 300 seconds. The next question is the stroke volume depends on end diastolic volume. This is best represented as. So stroke volume actually dependent on end diastolic volume. So this relationship is best represented as length, tension relationship. Because this is explained by a Frank Starling law that suggests that the amount of blood injected by the ventricle is dependent on the amount of blood present at the end of diastole in the ventricle. So by this you can easily conclude that the stroke volume is dependent on end diastolic volume is because of length tension relationship. So the answer is C. The next question is which of the following ions in the thick ascending loop of Henle is responsible for the resorption of divalent ions? Actually, the ion that is responsible in the thick ascending loop of Henle is potassium ion which responsible for the reabsorption or resorption of calcium, magnesium like divalent ions. Okay. So the answer here is C, potassium. The next question is which of the following sensory receptors are responsible for tactile discrimination? So they are asking for tactile discrimination. Tactile discrimination, the sensory receptor responsible for is Meissner's corpuscle. Okay. This is simple, straightforward as well as factual question. So the answer here is D, Meissner's corpuscle. The next question is all of the following increases gastric acid secretion except. So gastrin, yes, it increases gastric acid secretion. Histamine, yes, it increases gastric acid secretion. Acetylcholine, yes, it increases gastric acid secretion. But serotonin, no, it does not increase gastric acid secretion. It actually decreases gastric acid secretion. So the answer here is D, serotonin. Because it acts on gastric and colonic mucus and it increases the gastric motility and colonic motility. Okay. The next question is Pacinian corpuscle is stimulated by which of the following? So Pacinian corpuscle is actually mechanoreceptor which is stimulated by pressure. So the answer here is D, pressure. The next question is which of the following jugular venous pressure waves corresponds to the isovolumetric contraction phase of the cardiac cycle? So isovolumetric contraction phase of cardiac cycle is actually corresponds to the C wave of jugular venous pressure. So the answer here is B, C wave. Because A wave is responsible for atrial contraction, X descent is responsible for atrial relaxation, and Y descent is responsible for the emptying of right atrium into right ventricle in the systole after tricuspid valve opening. The next question is extracellular concentration of chloride is 100 millimole per liter and intracellular concentration is 10 millimole per liter. What is the equilibrium potential of chloride? They told in the first sentence is just a data. The next statement is the question that what is the equilibrium potential of the chloride? So the answer here is minus 60 millivolt. That is the actual equilibrium potential of the chloride. So the answer here is C, minus 60 millivolt. The next question is after reaching an equilibrium state during exercising, it was found that the body was consuming oxygen at the rate of 1500 milliliter per minute. Calculate the MET score if the baseline oxygen consumption at rest is 250 milliliter per minute. MET is actually metabolic equivalent. MET score is equal to body consumption rate of oxygen upon 1 MET or 1 metabolic equivalent. They are showing that baseline oxygen consumption at rest is actually 250 milliliter per minute. So it is actually regarded as 1 MET. Okay. So body consumption rate of oxygen is actually 1500 milliliter per minute and 1 MET is actually 250 milliliter per minute. So the answer here is 6 is the MET score. So the answer here is B, 6. The next question is all of the following cause a right shift of the oxygen hemoglobin dissociation curve except increased HbF. No, it causes the left shift of the oxygen dissociation curve. Okay, because oxygen is binding more closely and more firmly with the hemoglobin fetal type. Raised 2,3 BPG? No. Acidosis? No. Increased carbon dioxide? No. These all are responsible for right shift of the oxygen dissociation curve. Okay. But increased HbF is responsible for left shift of the oxygen hemoglobin dissociation curve. So the answer here is A. The next question is the latent period, contraction period and relaxation period of a skeletal muscle are 10 millisecond, 40 millisecond and 50 millisecond respectively. Calculate the titannizing frequency. So titannizing frequency is equal to 1 upon contraction period. So it is 1 upon 40 millisecond. So it is 100 upon 4. So it is 25 per second. Answer is D. Next question is an individual is in an environment of a temperature of 47 degrees centigrade. What is the mechanism of heat loss? So let us look at the option. Radiation, no. Conduction, no. Convection, no. Sweating is the mechanism of heat loss in a temperature of 47 degrees centigrade. So the answer is D. The next question is which among the following has the highest airway resistance? Let us look at the options. Alveolar duct. No, it is the smallest airway. So it has the lowest airway resistance, as well as respiratory bronchial and small bronchioles are also small airway. So they are also not the highest airway resistance areas. Bronchi is the actually medium sized airways. So this is the answer. Bronchi is medium sized airway which has the highest airway resistance. The next question is if the contractility of the heart is decreased, which of the following is seen? When contractility of heart is decreased, this will lead to slope changes in end systolic volume pressure curve. Because when contractility of heart become low, end systolic volume pressure curve slope change will happen, and that change actually leads to high end systolic volume as well as low stroke volume in the body. So there is slope changes in end systolic volume pressure curve is actually seen. So the answer is B. The next question is a lesion in which lobe will lead to impairment of hand-eye coordination. So they are actually asking the impairment of hand-eye coordination. So parietal lobe is responsible for hand-eye coordination. So parietal lobe lesion is actually responsible for impairment of hand-eye coordination. The next question is all of the following ions have decreased concentration on the luminal side of proximal convoluted tubule except amino acids, yes, glucose, yes, chloride, no, because sodium is reabsorbed at the luminal side of proximal convoluted tubule. So chloride concentration increases. Okay, so chloride is the answer. And bicarbonate, yes, its concentration is also decreases because it goes into the absorption. So chloride is actually increases in the luminal side because of sodium reabsorption from the sodium chloride compound. The next question is sodium iodide symporter is present in all of the following except thyroid gland. Yes, it is present in the thyroid gland. Placenta. Yes, it is present in placenta also as well as in salivary gland also. But it is absent in pituitary gland. So the answer here is D, pituitary gland. So with this, we complete our recall session. So thank you so much for watching and see you in the next one.